Look down at the skin on the back of your hands.
No.
Most people view that tissue as a simple cosmetic wrapper.
Right. They see it as something that just inevitably thins and wrinkles as we navigate life over the age of 60.
Exactly. We are taught to view it as a superficial boundary. But that fundamentally misunderstands human biology. Your skin, the integumentary system, is a highly porous, massive organ.
Yes, it is your body's primary defensive shield.
It is. And its largest immunological barrier, and critically, a direct delivery pathway straight into your systemic circulation.
Which is an urgent point to make.
It is. If you are listening to this deep dive, you are actively managing a senior body, and that means you are currently experiencing progressive biological deterioration.
The purpose of our discussion today is absolutely not aesthetic.
No, not at all. It is a matter of critical medical urgency. We are rigorously evaluating an extensive review of clinical data compiled by Dr. Thomas Morgan. This review scrutinizes the transdermal application of a highly specific botanical extract.
Specifically Nigella sativa.
Right, commonly known as black seed oil.
Yeah.
But more specifically than that, we are isolating its primary bioactive compound, Thymoquinone. We need to understand how it biologically intervenes in chronic pain, systemic inflammation, and the accelerated cellular aging happening in your body at this very moment.
That framing is an absolute necessity. I mean, we cannot discuss therapeutic intervention without first confronting the severe reality of the biological pathology taking place within the aging integumentary system.
Right. What are we actually looking at when we examine senior skin?
Well, when we examine a patient over the age of 60, we are not looking at an organ that is simply aging in some benign sense. We are observing an organ in a state of progressive structural failure.
It's a medical decline.
Exactly. The physiological declines are measurable, they are relentless, and they have profound downstream consequences for the rest of the body. To really understand this, we have to look closely at the extracellular matrix.
Specifically the collagen, right?
Yes, particularly the primary structural protein, collagen.
Now, for those managing their daily health, collagen is often marketed as a supplement or a cream. It's an aisle in the grocery store. But biologically, what is actually happening to the body's native collagen production once an individual passes that 60-year threshold?
The biological production of collagen effectively plummets. I mean, after age 60, you are losing approximately 1 to 2% of your collagen production capacity every single year.
That is a massive cumulative deficit.
It is. The fibroblasts, the cells responsible for manufacturing this protein, they become sluggish and dysfunctional. And this is not merely a loss of elasticity. It results in a profound, literal thinning of the deeper dermal layer of the skin.
The structural scaffolding of the organ is quite literally collapsing.
Precisely. And this collapse compromises the skin's barrier function. We have to consider the transdermal pathways.
By which you mean the microscopic channels.
Right. The channels, the intercellular lipid matrices, and the hair follicles. These allow molecules to pass from the surface of the skin directly into the bloodstream, completely bypassing the digestive tract.
So when the dermal layer thins and weakens, this barrier becomes highly vulnerable.
Highly vulnerable.
And the root cause of this structural collapse isn't just time passing. It is a mechanical failure at the cellular level, which brings us to the mitochondria.
Yes, the cellular engine.
Every single skin cell relies on mitochondria to function. They are the energy-producing engines generating ATP, or adenosine triphosphate. That powers cellular repair. But in a senior body, these engines begin to break down.
They become deeply inefficient.
Right. And this inefficiency leads to something much more dangerous than just a lack of cellular energy.
It leads to a severe biological crisis known as oxidative stress. As the mitochondrial electron transport chain degrades with age, it begins to leak.
It stops producing clean energy.
Exactly. Instead of producing clean cellular energy, the failing mitochondria generate a massive surplus of reactive oxygen species. In the medical literature, these are referred to as free radicals.
We must define this clearly for the listener, because oxidative stress is frequently minimized in popular health discussions. It is a highly destructive mechanism.
It is absolutely destructive. When these free radicals accumulate in the dermal tissue, they aggressively steal electrons from surrounding healthy structures. They damage cellular DNA.
They degrade the very collagen proteins we just discussed.
Yes, and they destroy the lipid membranes of the cells themselves.
Think of those failing mitochondria in your skin like a deteriorating, outdated municipal power grid.
That is a very accurate clinical analogy.
The grid is no longer just operating inefficiently. The containment has failed, and it is actively leaking toxic radioactive byproducts into the surrounding environment.
Right. And that localized damage in the skin tissue does not remain localized.
No, it doesn't. This continuous leakage triggers a massive emergency response from your immune system.
Precisely. The breakdown of mitochondrial function and the subsequent oxidative stress trigger the release of pro-inflammatory cytokines.
These are the signaling proteins.
Yes, signaling proteins that flood the area, alerting the immune system to severe tissue damage. The problem here is one of scale.
Because the skin covers the entire body.
Exactly. Because the skin is the largest organ covering the entirety of your body, a state of chronic oxidative stress within the integumentary system effectively acts as a massive, continuous inflammatory signal.
It's broadcast to your entire systemic circulation.
You are locked in a persistent low-grade state of biological emergency.
And in gerontology and internal medicine, this chronic systemic inflammation is widely recognized as the primary driver for nearly every major age-related disease.
It is the foundational pathology.
It damages the endothelial lining of the blood vessels, accelerating cardiovascular disease. It infiltrates the joint capsules, driving osteoarthritis and rheumatoid arthritis.
Inflammatory markers can even cross the blood-brain barrier.
Right, contributing to neurodegeneration. This direct progression from localized skin degradation to severe systemic inflammation is exactly why the medical community is urgently searching for multi-pathway interventions.
We require therapeutics capable of addressing multiple facets of this collapse simultaneously.
Which brings us to the core of Dr. Morgan's clinical review, Nigella sativa and its active molecule, Thymoquinone.
Now, before we detail the pharmacology, we must establish strict clinical boundaries.
Absolutely.
The compound under review is derived from the cold-pressed seeds of Nigella sativa plant. However, we must decisively separate the serious, peer-reviewed clinical literature from casual, unregulated wellness trends.
This is not a spa treatment.
No, the data surrounding this botanical is vast and highly credible. As of current medical catalogs, there are over 2,000 published scientific studies focusing on Nigella sativa and Thymoquinone, which we will refer to as TQ.
TQ is a bioactive compound, meaning it has a measurable biological effect on living tissue.
Exactly.
But I have to challenge this premise immediately because it runs counter to standard medical protocols. I mean, in modern pharmacology, polypharmacy is the standard for senior care.
Using multiple drugs for multiple issues, yes.
Right. If a patient has inflammation, they're prescribed a specific anti-inflammatory. If they have high blood pressure, they receive a targeted beta blocker. Synthetic drugs are engineered to target one specific biological pathway.
That is the modern pharmaceutical model.
But the literature suggests TQ works simultaneously through at least 5 completely distinct biological mechanisms. Frankly, how is it biochemically possible for a single naturally occurring molecule to effectively mediate 5 separate physiological pathways without causing catastrophic toxicity or biological confusion in the patient?
It is a critical question, and the answer lies in the fundamental difference between synthetic pharmacology and complex phytochemicals.
Expand on that.
Well, a synthetic pharmaceutical is an isolated, highly concentrated molecule engineered to forcefully block or stimulate a single receptor.
It's an aggressive intervention.
Very aggressive. And because it is so singular and aggressive, layering multiple synthetic drugs often leads to severe hepatic toxicity.
Liver damage.
Liver damage, exactly, or dangerous drug interactions. Thymoquinone, however, operating within its natural biological matrix, is a pleiotropic agent.
Pleiotropic, meaning it has multiple effects.
Right. It has the inherent structural ability to interact with multiple cellular targets and signaling pathways simultaneously. More importantly, it acts as a modulator, not an absolute blocker.
So it restores balance.
It restores cellular homeostasis rather than forcing a biological system into an artificial extreme. To understand how it achieves this safety profile while exerting such profound systemic effects, we must systematically dissect these 5 mechanisms.
Let's do that.
We begin with the most urgent priority for an aging body in distress, which is the immediate suppression of cellular inflammation.
Let us break down that first mechanism, the anti-inflammatory action. The clinical literature details TQ's specific ability to inhibit the cyclooxygenase 2 enzyme.
Widely known as TOX2.
Right. For context, this is the exact same enzymatic pathway targeted by standard over-the-counter pharmaceutical NSAIDs, medications like ibuprofen and naproxen. We know that aging bodies process these synthetic NSAIDs very poorly over long periods.
They process them poorly because of the lack of selectivity.
Explain the selectivity issue.
Well, traditional synthetic NSAIDs often inhibit both the COX-1 and COX-2 enzymes. Now, COX-1 is a constitutive enzyme.
Meaning your body requires it constantly.
Exactly. Your body requires it to maintain the protective mucosal lining of your stomach and gastrointestinal tract, as well as to ensure proper renal or kidney function.
So when you rely on a synthetic NSAID for chronic joint or skin inflammation, you are suppressing the inflammation via COX-2.
But you simultaneously strip away your internal organ protection via COX-1.
This is why long-term NSAID use in seniors frequently leads to gastrointestinal bleeding.
Yes, severe ulcers and renal failure.
But the data on thymoquinone shows a very different interaction with these enzymes. There was a notable study highlighted in the Journal of Ethnopharmacology that examined human subjects, not animal models, applying TQ topically.
And the results were highly specific.
Within 6 weeks of regular application, they demonstrated a significant reduction in localized skin and joint inflammation. Critically, the data showed TQ achieved this COX-2 inhibition without the toxic side effects associated with synthetic NSAIDs.
It suppressed the inflammatory prostaglandins without annihilating the protective functions of COX-1.
That targeted modulation makes it a viable, safe intervention for the chronic, daily application that an aging system requires to manage pain and tissue swelling.
Right. But simply halting the inflammatory cascade is only half the battle,
We must address the root cause of the cellular damage.
which is the massive oxidative stress we detailed earlier. This leads directly into the second mechanism, endogenous antioxidant activation.
How does TQ initiate this?
TQ initially functions as a direct free radical scavenger. Because of its low molecular weight and its lipophilic nature, meaning it dissolves easily in fats, it efficiently penetrates the transdermal pathways,
Reaching the deep dermal layer.
reaching the deep dermal layer where it can directly intercept reactive oxygen species.
Now, intercepting free radicals is a standard defense, but the literature points to a much deeper genetic interaction. There is a rigorously structured study from King Abdulaziz University demonstrating that thymoquinone actively stimulates the NRF2 pathway.
The NRF2 pathway operates as the master genetic switch for the body's entire internal antioxidant defense system.
The mechanics of this are profound.
They are. When TQ penetrates the aging skin cell, it causes the NRF2 protein to physically translocate into the nucleus of the cell.
It moves into the control center.
Exactly. Once inside the nucleus, it binds to the DNA and forces the cell to begin manufacturing its own endogenous antioxidants.
The most critical of these is glutathione.
Yes, which is unequivocally the most powerful antioxidant the human body is capable of producing.
The distinction between exogenous and endogenous antioxidants is absolutely vital here.
Mm.
If you apply a standard vitamin C serum to the skin, that is an exogenous antioxidant. It functions on a 1-to-1 ratio.
Right, one molecule of vitamin C neutralizes one free radical.
And then that molecule is depleted. Given the massive oxidative stress in a 60-year-old body, that is incredibly inefficient. It is like trying to put out a massive fire in a high-rise building with a small, handheld fire extinguisher.
Exactly. But by activating the NRF2 pathway with thymoquinone, you are changing the cellular programming.
You are forcing the failing machinery of the aged cell to manufacture its own defense.
Yes. A single molecule of endogenously produced glutathione can neutralize millions of free radicals over its life cycle because the body possesses the enzymes to continuously recycle it.
So to use the analogy, activating the NRF2 pathway is the biological equivalent of turning on the building's internal automated heavy-duty sprinkler system.
You are engaging a systemic defense protocol built into the architecture of the tissue itself.
Neutralizing free radicals and suppressing COX-2 inflammation stabilizes the skin. It stops further degradation.
But stopping the bleeding does not repair the structural collapse that has already occurred over 6 decades.
No. The medical imperative has to shift from pure defense to active tissue regeneration.
Which brings us to the third mechanism detailed in the literature concerning the upregulation of epidermal stem cells.
Before looking at the intervention, we really must define the state of stem cells in an older adult.
Well, epidermal stem cells are primitive, undifferentiated biological cells located deep within the basal layer of the epidermis.
Their designated function is to divide and differentiate into specialized skin cells.
Right, to regenerate damaged tissue, heal wounds, and maintain structural integrity. In youth, these cells are highly active.
But in an aging body battered by chronic inflammation and oxidative stress, a biological shift occurs.
These stem cells do not necessarily die off. Rather, they enter a state of deep cellular dormancy.
They are essentially asleep.
Yes. This is precisely why a minor skin tear or laceration takes weeks to heal in a senior, whereas it would resolve in days for a young adult. The tissue has simply lost its capacity to rapidly regenerate.
So the required clinical intervention is a mechanism to forcefully awaken these dormant cells. The journal Stem Cell Research and Therapy investigated the exact biochemistry of how thymoquinone interacts with human epidermal stem cells.
The research details that TQ systematically upregulates a specific network of signaling proteins.
Known as the Wnt-beta-catenin pathway.
Yes. The Wnt-beta-catenin signaling pathway acts as the primary communication relay dictating how and when a stem cell behaves.
What happens when TQ is applied?
When TQ is applied and reaches the basal layer, it stabilizes the beta-catenin protein. This stabilization allows the protein to enter the nucleus of the dormant stem cell, triggering a massive biological cascade.
It commands the cell to undergo proliferation, multiplying its numbers.
Multiplying and differentiation, meaning maturing into functional, healthy skin tissue. It is an active command to repair the deteriorating dermal matrix.
I must push for absolute clinical clarity regarding this mechanism. Manipulating cellular behavior carries severe inherent risks.
It does.
In a medical context, uncontrolled cellular proliferation is the exact definition of a malignancy. If we are stimulating the Wnt-beta-catenin pathway to force stem cells to rapidly multiply, how does this process ensure that these cells differentiate into healthy, structurally sound tissue rather than forming abnormal growths or carcinomas?
That is a mandatory safety consideration when dealing with cellular upregulation. The safety profile relies entirely on the concept of regulatory homeostasis.
Which brings us back to TQ's pleiotropic nature.
Exactly. When TQ activates the Wnt-beta-catenin pathway, it does not do so in an isolated, chaotic vacuum. While it promotes cellular division, it is simultaneously activating the NRF2 antioxidant pathway and suppressing the COX2 inflammatory pathway.
This creates a highly controlled, biologically sterilized environment.
The stem cells are dividing, but they're doing so in an environment meticulously cleared of the inflammatory cytokines and oxidative mutagens that typically corrupt cellular division and lead to dysplasia.
Furthermore, the signaling pathway enforces strict differentiation.
Yes, the cell is guided to mature into a specialized keratinocyte or fibroblast, completing a normal functional life cycle. It is guided tissue regeneration, completely distinct from chaotic, malignant multiplication.
The clinical implications of guided regeneration for a senior are staggering. We are discussing an intervention for severe dermal degradation. As the skin thins, blood vessels lose their padding, becoming fragile and rupturing upon minor impact.
Leading to severe bruising and hematomas.
And slow wound healing drastically increases the risk of systemic infection. Stimulating the biological hardware to manufacture new, structurally sound tissue is a profound shift from merely managing decay.
Yet newly formed tissue remains highly vulnerable if the external environment of the skin is biologically hostile.
Right. The skin cannot heal if it is under constant microbial attack. This requires us to examine thymoquinone's fourth mechanism.
Microbiome restoration and immunomodulation.
We must first understand the baseline biology of the skin's surface. Your skin is not a sterile environment, nor should it be.
No, it is colonized by a complex, localized ecosystem of millions of bacteria, fungi, and viruses known as the microbiome.
In a healthy state, this community is commensal. The beneficial microbes form an active, protective biological shield against invasive pathogenic organisms.
However, the aging process severely disrupts this balance.
How so?
As you age, the pH of your skin alters, sebum production decreases, and the protective acid mantle thins. This creates a state of severe dysbiosis.
Protective bacteria die off.
Yes, allowing pathogenic bacteria to overgrow. This structural disruption is the direct clinical cause of increased vulnerability in seniors to severe dermatological conditions,
like severe eczema, psoriasis, rosacea,
and highly dangerous staphylococcal infections.
When a senior presents with a severe skin infection or dysbiosis, the standard medical protocol is often a topical broad-spectrum antibiotic cream. But the clinical literature demonstrates TQ possesses broad-spectrum antimicrobial activity. How does the pharmacological action of thymoquinone differ from applying a standard pharmaceutical antibiotic?
The difference is fundamental to long-term immune health. Traditional broad-spectrum antibiotics act indiscriminately. They are chemical agents designed to eradicate bacteria.
In doing so, they destroy both the harmful pathogenic bacteria causing the active infection and the protective beneficial bacteria required to maintain the defensive barrier.
This indiscriminate destruction is a major medical flaw in long-term senior care. By creating a biological vacuum on the skin, you leave the tissue completely defenseless.
And once the antibiotic course concludes, that vacuum is frequently repopulated by antibiotic-resistant pathogens.
Leading to recurring, progressively more severe infections.
Treating the fragile microbiome of senior skin with continuous broad-spectrum antibiotics is the biological equivalent of clear-cutting an ancient forest to eliminate a single, localized pest.
You destroy the threat, but you obliterate the foundational ecosystem required to sustain life.
Exactly. Thymoquinone operates differently. The literature indicates it exhibits highly selective antimicrobial properties.
It actively disrupts the biofilm formation of specific pathogenic bacteria, such as Staphylococcus aureus, preventing them from anchoring and colonizing the tissue.
Concurrently, it appears to largely preserve the commensal flora.
TQ acts as a biological regulator, culling the pathogenic overgrowth while nurturing the foundational ecosystem. By restoring this equilibrium, it repairs the outer wall of the body's fortress.
And we must remember, the health of this localized skin microbiome is intimately linked to the systemic immune system.
If the skin's barrier fails, the internal immune system is subjected to a constant, exhausting influx of pathogens, draining the body's overall regenerative reserves.
When we discuss regulating cell function, guiding cellular division, and managing localized immunity, our focus inevitably turns to the most severe failure of cellular regulation in the human body.
Oncology.
This brings us to the fifth mechanism documented in the clinical review. Before proceeding, we must establish a definitive medical disclaimer.
Absolutely imperative.
We are analyzing peer-reviewed in vitro literature conducted on human cancer cell lines in highly controlled laboratory environments. Thymoquinone is not a prescribed cure for systemic cancer.
With that strictly understood, the data regarding its interaction with mutated cells requires careful examination. The literature focuses heavily on the induction of apoptosis.
Apoptosis is the biological term for programmed cellular death. It is the body's natural, highly regulated mechanism for eliminating cells that are damaged, severely mutated, or simply no longer functional.
In a healthy human body, when a cell detects severe DNA damage within itself, it intentionally triggers its own destruction to protect the larger organism.
The pathology of cancer relies entirely on bypassing this exact mechanism.
Right. Cancer cells achieve a form of biological immortality by mutating their internal signaling to actively evade apoptosis.
They refuse the biological command to self-destruct.
And instead, they divide uncontrollably, consuming the host's resources.
The clinical data demonstrates that TQ aggressively targets this exact evasion tactic by interacting with specific intracellular proteins. Two proteins are consistently highlighted.
BCL2 and P53.
Yes, those are the primary targets of intervention. Explain BCL2.
BCL2 is an anti-apoptotic protein. Cancer cells upregulate BCL2, effectively using it as a biological shield against self-destruction signal.
And P53.
P53, conversely, is a tumor suppressor protein, frequently referred to in oncology as the guardian of the genome. Its job is to initiate apoptosis when a cell becomes dangerous.
Thymoquinone has been shown to aggressively downregulate the BCL2 shield while simultaneously upregulating P53 expression.
By forcibly altering these specific protein levels, TQ strips away the mutated cell's immortality and forces it to undergo healthy, programmed apoptosis.
It commands the damaged cell to self-destruct.
Yes.
A comprehensive meta-analysis published in the journal Phytotherapy Research analyzed 31 distinct peer-reviewed studies investigating this specific activity.
The aggregate data demonstrated consistent, highly powerful pro-apoptotic effects across multiple aggressive human cancer cell lines.
Notably including breast, colon, liver, and skin cancer cells. The mechanism of forced programmed cell death remained remarkably consistent across these different cellular mutations.
It did.
However, I must strictly define the limitations of this data regarding transdermal application. Applying a botanical oil topically to the dermis does not equate to a systemic oncological treatment for internal tumors.
No, it does not.
The primary proven clinical target of transdermal application remains the dermal layer itself.
That is the correct medical parameter, and it is a critical one for an aging demographic. The skin of an individual over the age of 60 contains millions of cells that have sustained decades of cumulative ultraviolet radiation damage.
And profound oxidative stress.
Exactly. These localized cells are highly prone to malignancy, frequently manifesting as basal cell carcinomas and squamous cell carcinomas.
The localized application of TQ addresses localized cellular mutation.
The objective is the proactive destruction of these severely mutated skin cells via forced apoptosis before they can proliferate into visible aggressive carcinomas.
We have systematically detailed 5 highly complex biochemical mechanisms: COX2, anti-inflammatory action; NRF2, antioxidant activation; 1-beta-catenin stem cell upregulation; microbiome modulation; and apoptotic induction via P53.
However, introducing a bioactive compound to the skin does not guarantee it will effectively execute these pathways.
No. The biological efficacy of this intervention relies entirely on strict chronobiology. The timing of application is not a matter of scheduling convenience. It is a biological imperative.
Chronobiology dictates how biological systems adapt to solar rhythms, specifically the circadian rhythm.
For seniors aiming to influence cellular repair, understanding the chronobiology of the sleep phase is paramount. We must focus on the critical metabolic window that occurs roughly between 10 o'clock at night and 2 o'clock in the morning.
During this specific time frame, your body initiates a profound automated shift in its hormonal and physiological environment.
What exact hormonal shifts are creating this window of opportunity?
First, the secretion of human growth hormone from the pituitary gland reaches its absolute peak during this early sleep phase.
Growth hormone is the master signaling molecule that authorizes cellular repair and tissue regeneration across the entire body.
Simultaneously, your systemic levels of cortisol drop to their absolute lowest trough of the 24-hour cycle.
Cortisol is a stress hormone. It is entirely catabolic. It breaks tissue down, it actively suppresses the immune system, and it inhibits the inflammatory resolution process.
Therefore, strictly between 10 p.m. and 2 a.m., your body is biologically primed for intervention. Repair signals are maximized, and degenerative stress signals are minimized.
Beyond the hormonal environment, there is a physical change in the integumentary system itself during these hours, known as nocturnal transdermal conductance.
Yes. During the sleep phase, the physical temperature of your skin rises slightly, and the microcapillary blood flow to the dermal layer increases.
As a direct physical consequence, the epidermal barrier becomes measurably more permeable. The tightly packed lipid matrix of the skin literally relaxes.
This physiological relaxation means that therapeutic substances applied to the skin immediately prior to this window are able to penetrate significantly deeper into the tissue.
They bypass the defensive, hardened layers of the stratum corneum with far greater efficiency.
The thymoquinone molecules become exponentially more bioavailable to the underlying basal cells and systemic circulation than if they were applied during the waking hours.
Applying thymoquinone during active daylight hours is biologically equivalent to attempting major structural repairs on a busy highway during the peak of rush hour traffic.
The environment is chaotic, the system is defensive, and the transdermal absorption rate is profoundly suppressed by high cortisol.
The vast majority of the bioactive compound will simply oxidize on the surface of the skin or be wiped away.
But applying it strictly before the 10 p.m. to 2 a.m. window shuts down the highway.
You are synchronizing the introduction of the NRF2 and beta-catenin activators, exactly at the moment the cells are naturally attempting to initiate DNA repair.
You are providing the cellular machinery with the precise molecular tools precisely when it is scheduled to use them.
Understanding the biological mechanisms and the critical timing demands that we now outline the precise clinical protocols for safe, effective use.
The pharmacological efficacy of thymoquinone is entirely dependent on the structural integrity of the molecule at the exact moment of application.
The commercial market is heavily saturated with inferior, oxidized, or biologically inert formulations. We must establish the strict purchasing criteria required to avoid contaminated products.
The source material must explicitly state that it is cold-pressed, completely unrefined, and certified organic Nigella sativa.
We must emphasize why these processing criteria are non-negotiable. If a manufacturer utilizes heat processing to extract the oil rapidly, the thermal energy instantly denatures and destroys the delicate thymoquinone molecule.
The resulting oil may smell like black seed, but it is biologically dead.
Furthermore, if chemical solvent extraction, using agents like hexane, is utilized to maximize oil yield from the seed, microscopic toxic contaminants become permanently trapped in the final product.
You would be systematically massaging a petrochemical solvent into your highly permeable aging skin every single night.
To avoid this entirely, you must demand a third-party certificate of analysis from the manufacturer.
This laboratory document must explicitly confirm a standardized thymoquinone content strictly between 1% and 3%.
If the documented TQ content is lower than 1%, the dosage is subclinical. It will not trigger the genetic pathways we have discussed.
And if a manufacturer refuses to provide an independent certificate of analysis detailing the exact TQ percentage, the product must be dismissed entirely as a medical intervention.
Once a clinical-grade, high-TQ product is procured, the application protocol must be executed with exact precision.
The baseline protocol requires dispensing approximately half a teaspoon of the unrefined oil into the palms of the hands.
It must be rubbed together to warm the oil slightly, matching it to body temperature, which aids in immediate transdermal conductance.
The application must utilize gentle, sustained circular motions.
For seniors managing chronic conditions, where exactly should this topical intervention be targeted?
For localized intervention regarding chronic joint pain and targeted COX-2 inflammatory suppression, direct application is required over the severely affected areas.
This includes the lumbar region of the lower back and the articular capsules of the knees.
Crucially, for seniors who frequently suffer from severe debilitating osteoarthritis in the hands, the oil must be deeply and methodically massaged directly into the knuckles and the highly permeable webbing between the fingers.
This allows the lipophilic TQ to penetrate down into the inflamed synovial fluid of the joint capsules.
And for the broader systemic benefits, specifically targeting the stem cell upregulation and NRF2 systemic antioxidant defense.
For systemic absorption, you must target the areas of the human body with the thinnest epidermis, the highest concentration of blood vessels near the surface, and the highest baseline transdermal absorption rates.
These primary high absorption zones are the upper chest, the inner forearms, and the anterior neck.
The physical application is only the first step. The duration of the application process is equally critical. The oil must be allowed a strict minimum of 10 uninterrupted minutes to fully absorb into the lipid matrix of the skin before it is covered with clothing or bedding.
Prematurely covering the area will result in the fabric physically wicking the bioactive compound away from the dermal layers, wasting the clinical dosage.
Furthermore, biological change at the genetic and cellular level is a protracted process. You are attempting to upregulate dormant stem cells and suppress entrenched chronic inflammatory cascades.
This does not happen over a weekend.
This precise nocturnal protocol must be executed consistently every single night for a mandatory minimum of 8 weeks before any objective biological evaluation of the results should be attempted.
Consistency is the primary vector of success. If you apply it sporadically, you fail to provide the continuous cellular signaling required to permanently awaken the 1-beta-catenin pathway.
We must now transition to the most critical warnings of this discussion: safety and contraindications. While Nigella sativa possesses a profound documented safety profile, Thymoquinone is a highly potent bioactive substance.
It fundamentally alters human physiology, and therefore it has distinct medical interactions.
First, we address cardiovascular medications.
Yeah.
If you are currently prescribed and taking pharmaceutical blood-thinning medications, specifically systemic anticoagulants such as warfarin or Plavix, you are biologically required to consult your primary care physician before initiating this transdermal protocol.
Thymoquinone possesses mild, naturally occurring anticoagulant properties.
Combining systemic transdermal TQ with highly calibrated pharmaceutical blood thinners may alter your prothrombin time, artificially extending the time it takes your blood to clot, thereby increasing severe bleeding risks.
Second, we must address dermatological hypersensitivity.
If you possess any known severe allergies to plants within the Ranunculaceae family, which is the specific botanical family of the black seed, you must perform a localized patch test.
Apply a single drop of the clinical-grade oil to the thin skin of the inner wrist and monitor the site strictly for 24 hours, checking for erythema, localized swelling, or contact dermatitis prior to initiating broader systemic application.
Finally, and with absolute urgency, active chemotherapy. If you are currently undergoing active pharmaceutical chemotherapy or targeted radiation therapies for an oncological condition, you must undergo a strict formal consultation with your treating oncologist before introducing Thymoquinone to your biology.
This strict warning is not because the oil is inherently toxic to the patient.
No. It is because the introduction of a highly potent, multi-pathway bioactive compound introduces complex, unmapped variables into a highly precise, highly lethal pharmaceutical protocol.
We must mathematically ensure that the powerful antioxidant capabilities of TQ do not inadvertently protect the targeted malignant cancer cells from the intense oxidative stress intentionally generated by the chemotherapy drugs to destroy them.
I must reinforce the gravity of that warning. You must approach this non-prescription protocol with the exact same rigor, dosage precision, and safety awareness as you would a highly potent prescribed pharmaceutical.
The fact that a molecule is naturally occurring in a botanical does not negate its profound biological power. It commands your cells to alter their behavior. It must be respected as a serious medical intervention.
We have systematically detailed the immense physiological benefits established in the clinical literature regarding thymoquinone. For the aging senior body, its transdermal application offers a scientifically validated, multidimensional method for mitigating chronic joint pain without NSAA toxicity.
It demonstrably slows the structural collapse of the dermal matrix by suppressing KOX2 inflammation and forcing the endogenous production of glutathione via the NRF2 pathway.
It selectively regulates the vulnerable skin microbiome, preventing dysbiosis.
And it aggressively manages cellular aging by upregulating dormant epidermal stem cells for tissue regeneration, while inducing necessary apoptosis in severely damaged, potentially malignant localized cells.
We have detailed 5 proven, highly distinct biological pathways accessed and modulated via a single, naturally occurring compound.
Which logically forces a confrontation with a very disturbing question.
If a single intervention possesses this level of rigorous, peer-reviewed clinical scrutiny and demonstrates this profound level of multi-pathway efficacy, why does it remain largely obscured from standard patient care and mainstream gerontology?
We must frankly address the economic reality of modern medical research and the architecture of pharmaceutical distribution.
Naturally occurring plant compounds like the exact complex molecular structure of Nigella sativa and thymoquinone are products of nature. Under current international intellectual property law, products of nature cannot be patented by a medical corporation.
Without the exclusive multi-billion-dollar financial incentive provided by an ironclad patent monopoly, there is absolutely no corporate funding available to execute the massive, multi-center Phase 3 clinical trials required by regulatory bodies.
Trials required to formally integrate a substance into standard mainstream medical guidelines.
It is a systemic failure of the economic model of medicine, not a failure of the biological science.
The clinical data exists. The biochemical mechanisms are proven in vitro and documented in localized human trials. The safety profiles are established.
But the financial architecture required to mandate its presence in a primary care physician's office simply does not exist because it cannot generate an exclusive profit margin.
I will leave you, the listener, with this final, incredibly serious point to ponder as you manage the trajectory of your own aging biology.
If a highly accessible intervention, backed by over 2,000 peer-reviewed medical studies and demonstrating profound multi-pathway biological efficacy, is completely sidelined simply because it lacks a patentable financial structure, you must ask yourself a critical question.
What other vital, scientifically grounded, and highly cost-effective treatments for the deteriorating human body are currently being ignored, suppressed, or dismissed by the modern pharmaceutical apparatus?
You cannot rely solely on the commercial medical establishment to provide all the answers to your biological decay.
We respectfully thank you for joining us today for this deep dive, for prioritizing your advanced health education, and for treating the maintenance of your biology with the absolute seriousness it demands.
True bodily survival over the age of 60 requires continuous critical evaluation of the independent medical literature. Continue to study the data.
The standard X-ray machine of modern diagnostics may not always show you the underlying cellular deterioration, but the rigorous science of chronobiology and cellular repair is clearly visible if you know where to look.